There's two things you need to ask yourself when choosing a plan type. Once you figure out where to get your insurance from, you'll probably be presented with a few different plan types to choose from. The four most common types to choose from are HMO, EPO, POS, and PPO. What these acronyms stand for is honestly not important. What is important to know is if your plan requires you to stay in-network and if your plan requires you to have a referral to see a specialist. So what do I mean by that? Well, being in-network simply means that your doctor, hospital, or whatever healthcare provider you're at is willing to accept your health insurance. In practice, what this means is that if you choose a plan that requires you to be in-network, you'll only be able to see certain doctors and healthcare providers, so your options may be limited. Some plan types also require you to have a referral to see a specialist. What this means is that if you want to see a specialist, you first have to go to your doctor and have them recommend the specialist for you. While it is kind of nice to not have to worry about figuring out who to see, most people do consider it a major drawback to not be able to choose your own specialist. Alright, so that was a lot. So just to recap, there's two things you need to ask yourself when choosing a plan type. First, do you care about having to be in-network? And second, do you care about needing a referral to see a specialist? If you're okay with staying in-network and you don't care about needing a referral to see a specialist, then you should just stick with an HMO plan. It's typically the cheapest and it fits your needs. If you're okay with staying in-network, but you do want a bit more flexibility to choose your own specialist, then an EPO plan is right for you. If you don't want to have to stay in-network, but you are okay with having referrals for your specialists, then POS plans are the way to go. And lastly, if you want the ultimate flexibility of not being in-network and not needing referrals to see specialists, then you should stick with a PPO plan. Now, depending on how many plan options you have to choose from, knowing your plan type may already be enough for you to decide on which plan to get.